and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and one of the MCs here at Gold. And today I'm very excited to have a guest here with me. It's Stephanie McBride. Welcome, Stephanie.
Hi, thank you, Kristen. Great to be here.
It's so lovely to have you here. You are part of the Midwifery Conference this year of 2024, and your topic is Aromatherapy and Midwifery Practice Clinical Pearls. I'm so excited about this.
Yes.
But before we get into this, first of all, let me ask you this. You are a clinical herbalist, a nutritionist, and how did you get into the field of essential oils, and how did that all come together? How did this all fit together?
Yes, well, actually, I studied herbalism for like 20 odd years before I had my own babies. And I'd always thought like I'd tried essential oils and aromatherapy, but nothing really took with me. I didn't, it just was a nice scent. And I had a moment during my labor with my first child where I was nauseous I'd already been in labor for a long time. And I was just kind of like out of sorts. I'd almost like forgotten what I was doing. I think we can relate to that feeling during labor. And my midwife, I didn't know what she was doing, but she put a drop of peppermint essential oil into the bucket I was vomiting into. And it absolutely transformed my experience of labor. Like I was awake, I was energized, it helped with my pain, my nausea completely went away. And it was just like a friend, it was like such an amazing ally for me in that moment that I just left that experience feeling like so grateful to have that essential oil in that experience. And I really wanted more people to know about this. I'm like, why don't we all do this? So that was something that helped me to bridge the gap and really recognize the power of aromatherapy and to add that more to my clinical practice, which was mostly nutrition and herbs at the time.
Mm-hmm.
Kind of
And
how
you
that all
really
started.
researched it and studied it, it's because I know like essential oils in the recent years have become so popular, right?
Yes.
We see them online, we see people talking about it, using them. Now, when it comes to pregnancy and birth and postpartum, they can be great tools. However, also, many dabble and many think like, oh, it's all natural. Just throw them on or do something with them. But
Yes.
we do need to be careful as well. We need to know what we're doing. So talk a little bit about that.
I 100% agree with you. And that's actually why I started to study this so in-depthly, is because working with people as a nutritionist, most of the people I worked with in my clinic, it was like a family, women's health clinic. A lot of people were pregnant, they were trying to
Mm.
conceive, they were postpartum, people had young kids. And people kept coming to me and saying, I want to use aromatherapy, I want to use essential oils. And there were a couple books going around that were really popular that had absolutely no safety guidelines and then for
Mm.
pregnancy. And I just couldn't feel okay with recommending and confirming people's uses for oils. A lot of people were ingesting essential oils in a way that I felt was kind of dangerous or just
Mm.
like without proper background and knowledge in their uses. I think there should be more guidelines because essential oils are natural, but they're like the most potent part of the plant, and they actually cross through cell membranes, through the placenta, into breast milk, across the blood-brain barrier. Only takes like one drop to have a huge impact. So in that sense, we do need to have knowledge because people can, they're very safe if you know how to use them, I guess is what I'm saying. So I went about studying, I read every single research paper I could find. I interviewed midwives across the globe. I started using them in clinical practice. And then I had my own history of herbalism and science and human health behind me as well. But I wanted to create a better book that was
Mm-hmm.
like, yes, these are fun and they're safe and everyone should use them, but like you should know A, B, and C. And especially if you're
Mm-hmm.
recommending them to people you're working with, you don't want to be the one that, tells someone everything's safe and then they get a massive sunburn because the melanocytic
Right.
hormone is higher in pregnancy and we're more susceptible to sun sensitizing oils. Like, those are things we need to know recommending those. So I'm really grateful that I could do that work that I'm so passionate about and offer, these tools to other people. I think they're useful.
Yeah, and you've written a book, Essential Oils for Maternal Wellness, and you also
Yes.
have you have a program as well for healthcare providers. So you really are an expert in the field. So
Yes.
Absolutely
Thank you. Yeah,
wonderful.
I'm so excited about my Roma birth program is now, it's almost ready in 6 languages. And I mean, here's
Fantastic.
my book in German. I just got this. I just heard it's being published in Chinese. So I'm just really excited that I can actually share this globally. Pretty cool.
Wonderful. Wonderful. And I know you're a little sneak peek here. You might be giving something away, right? For other, to one of
Yeah,
our viewers. But
I'm
yeah,
basically giving away like one of everything. So I have two different books that are digital and there's some different language options. And then also my Roma birth training program, I have that to offer. And I have a
perfect.
freebie, a safety book that everyone can download. So yeah, I'm really excited and to offer all these things to you, this
Wonderful,
wonderful
wonderful. And
community.
a very important sentence here for everyone. This is a 1 hour presentation. That does not mean everybody is an aromatherapist, right? We have to
Right.
be a scope of practice. Please
Yes.
talk about that for a moment as well.
Yes, well, this is very important to me. And I actually teach people about essential oil use in pregnancy for self-care also.
Mhm.
And sometimes I teach an audience with, physicians and, midwives and doulas and, people that are parents to be in the same group. So I've gotten to be really careful and refined at letting people know when something's outside of scope of practice. For example, I know that these can be used very successfully for hypertension, and gestational diabetes and, like a lot of clinical issues. But I want to make sure that we're not going to ignore recommendations of medical professionals and substitute, you know, medical treatments for
Right.
essential oils. And that also people don't substitute this in their self-care. So I am pretty diligent about mentioning like, okay, I'm going to talk about something clinical here, let's not work without outside our scope of practice for this.
Absolutely. Fantastic. Well, thank you for sharing
Mhm.
that. And now to the exciting part. You have a little something for us, right, Stephanie? So go ahead.
Yes. Well, I'm going to get really basic here and then also not really basic, but it's so simple. So I have two of my favorite essential oils here for waking up the brain and energizing. And I love this for all of pregnancy and also for labor because one of the oils is peppermint, which is just,
Hmm.
like I said,
Love
I use it
peppermint.
during
Yeah.
my own pregnancy. It's so wonderful for waking up your brain and energizing your body. And then the other one is frankincense, which is
Mm.
just this grounding, like be here now oil. It crosses the blood-brain barrier. It's really high in sesquiterpenes. So it gets into the brain and it helps a lot of people with, like brain fog and autism spectrum and dementia and all kinds of things. But I like to just put a drop of each in my hand, or it could be more than one drop like that. And then you just rub your hands together. And if you have this at home, you can try it now. And you just take usually like 2 or 3 breaths out of your hands and then wash your hands. Or actually, I usually rub them on my body, but make sure not to get these in your eyes. But that's just such an easy way to use essential oils aromatically, and it's way different than a diffuser. And then another thing you can do if you want to take it to a different level, and this is something I learned, I studied traditional herbalism for years, and a lot of it was from like Native American tradition. I studied in Latin America, so a lot of like really traditional uses for essential oils and learning plant medicine. And that is to get into a very relaxed state of mind before you experiment with something new, whether it be, a tincture of a new herb that you pick up or an aromatherapy blend that you're smelling for the first time. When I get a new blend, before I read about it, I do this. Okay. So what I do is I just sit quietly. I count back in my mind from 100 to 0. So basically, you're quieting your mind in order to get into what's called the alpha state of mind. And alpha is just a brainwave if you haven't heard of it, but it's a place where people associate it with first waking up in the morning when you have those moments of clarity. Also, like when you're in meditation, but it just opens you up to more intuitive thoughts. It quiets the mind, but it also like helps with your memory and your insights. And I really love, like, this has directed my life in so many ways, including my career path, friendships and just life choices. But I really love applying this to natural medicine because it helps me to get a different level of understanding from it.
Hmm.
And yeah, so you can do that kind of practice, just count backwards from 100 to 0 and then smell the oils out of your hands. Or even like I use this technique for assessing food allergies as well. So there's all kinds of things you can do with this, but if you're
Fantastic.
interested in that kind of thing, give it a try.
Thank you so much, Stephanie. That was
Sure.
absolutely fabulous. I am so looking forward to your presentation here at Gold. Again, the presentation is part of the Midwifery Conference, Aromatherapy in Midwifery Practice, Clinical Pearls. So thank you so much for being here with me
Thank
today,
you,
Stephanie.
Kristen. Thank you.
And for our viewers now, if you would like to find out more about this presentation and essential oils, of course, and the other presentations in the conference, we invite you to go to goldmidwifery.com. Don't forget, we get started next month, early next month on the 5th of February. And we have a keynote presentation that is open access for everyone to enjoy. So make sure you sign up for that presentation as well. And I hope to see everyone at the conference. And I wish you a lovely rest of your day wherever you are in the world. Bye-bye, everyone.